So I'm going to start us off so you can hopefully answer the question, what the heck are they talking about and what is this research on? So I'm based at Syracuse University at the Daniello Institute for Veterans and Military Families. We are an independent institute within the university, and we have direct programs and services that primarily focus on entrepreneurship and career training. And then we have research, evaluation, technical assistance, and policy work. And then obviously, because we're at the university, there's a lot that we do related to higher education and supporting student veterans. Okay, so why did we help develop a model for a coordinated care network? And also, I should add when. Some of this dates all the way back to research that we did in 2014 that did not focus on this at all. It was just asking transitioning service members what their top challenge was when they left the military, and overwhelmingly the top challenge was navigating benefits and services that they were eligible for. So it was about higher ed and some other things, and that was the unexpected finding. And so our team worked with a few communities early on, and a couple of funders in New York City, Pittsburgh, and Charlotte, North Carolina. And I have a special call out here to our secret audience plant, Dr. Ben Stahl, who you will hear about the model. His organization is the coordinated hub coordination center, whatever you want to call it, in the middle of the referral network. So if any of your questions are like, how do you do X, we'll be calling on Ben as our ringer. So in addition to what we know were the needs of veterans separating from the military, those things have been repeated in needs assessments over time. That finding still holds true about navigation being a top challenge. It's especially difficult for this population because eligibility criteria, I think, is even more complex than with many other populations. So it made sense to us to try to solve for that problem. And then lastly, we know that there's tens of thousands of CBOs, or in our space we call them VSOs or MSOs, serving this population, but then also just organizations that serve veterans and may not even know they're serving veterans, or they have one veteran program inside of a broader organization. So, and we knew that a lot of things were happening at the same time, particularly when people leave the military. Where are you moving? Do you need a house? Do you need a job? Do you need a car? Like all those things that might happen at that time, we know also happen to people throughout their lives. So how do we solve all those problems at the same time? So we, through several years of work, co-developed this model with those three communities and some early stakeholders, and then we're able to replicate it, which I'll talk about in a minute. But the general process was we would look at different communities and identify whether the conditions made sense for us to work on this problem in those places, and some places booted us out early on and didn't want to do this work. Some ended up inviting us back later, but Pittsburgh, New York City, and Charlotte were game to work on this. And so once we knew we had enough support and funding, we would gather the stakeholders together in a series of meetings that we've called strategy sessions or listening sessions, whatever the case may be. And then everyone would kind of align, and we used a loosely adaptive collective impact model to do this. Wasn't super strict, but it helped people align on the shared mission, shared measures, and agreeing that we needed some kind of backbone organization. So then, when people were ready to do this, we would organize a way to do a competitive process to select the hub or coordination center, as we call it. And then that would be done by organizations in the community, some representatives of funders and ourselves, and we would pick a coordination center, which is where Ben's organization is now sitting in that role, and then pick a referral management platform. In early days, we did. I can just say we used Unite Us in the early days and worked with them actually a lot to develop the software to make it work best for veterans. So sort of what it grew out of, and so that now. That's not, some of them have switched platforms. We work with partners that don't use the Unite Us platform. It's been a much more crowded space, but that's what we did in the early days, and it made it a lot easier for us to scale. And then last, we would onboard all the providers that had come into those strategy sessions, make sure they were trained not just on the platform, but also process and expectations. And then this is really, you can look at this online, but the basic thing is it was a hub and spoke model so that no matter where a veteran or their spouse or caregiver would show up, they would end up at the coordination center for a more holistic intake to identify and triage needs, and then get referred out to providers in the community for in whatever order and time frame made the most sense. And it was the coordination center's job to understand, oh, did that grant program run out of money? Can I still send somebody there? Oh no, I'm gonna send them somewhere else instead, do that work. And then once those needs were either addressed or not addressed, the expectation was for the provider to record what happened in the Unitas platform. And then if there was something else that they identified in doing that work, they could just send another referral back into the coordination center. So that's kind of the general process. And then of course, people could just call or submit a form directly to the coordination center to just refer themselves. So scope-wise, those networks, the planning really started in like 2013. The first launches, those 3 cities, were throughout 2015. And then by 2021, we had launched 18 networks. There were a few that launched separate from our work, but because they also used Unitas at that time, we partnered with them and provided some technical assistance and measurement and evaluation support for them, because you could at one point make referrals between and across those networks, which was really interesting. So that number is a little fuzzy because, as you see at the bottom, probably the biggest takeaway, it's a different environment now than it was in 2015 for this. It's a much more crowded space for models and for technology. So a lot of these networks are not existing in the form that they did at the time. And that also changed the access that our team had to data. And so some of this data, as big as those numbers are, that is woefully out of date. There's tens of thousands more people and requests that have been addressed since we last did this number. And then lastly, all those communities and some other partners of ours participate in a national community of practice for all the hubs, basically. So if you are a hub or coordination center-like entity, we will gather you and we do training, we help people just make space for them to talk to each other, things like that. So now I'm gonna go to the evaluation framework, but other people, Zach and others, are gonna kind of allude to some of this. But when we were thinking about this, we really focused on the fact that when these places were starting out, some of them were collaborating at different levels, but it was pretty loose, pretty informal. There wasn't a network, so to speak. And so because we were thinking about it a little bit from the collective impact perspective, we really tried to give everybody and ourselves credit for creating a whole system of care where previously there was none. And our vice chancellor comes from an entrepreneurship and small business world and kind of was thinking supply chain oriented to an extent. And he's like, how do we measure moving people around a health and human service system? And so we landed on these measures that kind of relate to systems theory more than just at the individual level, but you'll see there are other things in there that sort of make it more well-rounded. So here, it's just easier with examples. So the biggest things that we looked at were around, is this network doing the thing that they said they would do? Are they getting people from the hub to the organizations for the thing they asked for? Are they getting it right the first time? Are they doing it quickly? And is the organization going in and saying, yes, I delivered the service that was requested? That's really the bread and butter of the network and process measures. But that does not a healthy network make, as I think you guys all probably know. So we also looked at how strong are the partnerships? How many organizations are in the network? Are they making referrals? Are they receiving referrals? You might not expect a small, equine therapy organization to be getting a whole bunch of referrals, but they're working with veterans that are struggling, perhaps, and then they build trust and then they identify a need, and so they might be an organization that you would expect would refer into the network. So we looked at things across that sort of basket of measures, and then we looked at growth over time, because the last thing is sort of can this performance, can this quality of service delivery be maintained as scale increases? And so we looked at growth, we looked at whether people were coming back over time, which is kind of what Mara was gonna talk about, and we looked at what percentage of people were coming to us for more than one thing at a time. Within, let's say, a year, we would usually see over half the people would be coming more than once for something, and that 3/4 of the time, if they were coming for more than one thing, it was in two totally different domains, not the same thing. Though people do come back for the same thing, which is another thing we would look at. And then lastly, community conditions. Can these models be sustained? I think that's another way that the landscape has changed a lot in the last decade or so. And then is there enough buy-in and support from people that you wouldn't expect necessarily to be referrers necessarily, but they're supportive and they champion the network? And I think that's probably, well, I'll show one more thing. So this is what this just might look like when we were doing the measurement and evaluation work. We would analyze the data and give it back to the communities, and then we would go and work with people like Ben and his team, and we would have community data-driven conversations. And so it was using largely these things to say, like, okay, this was sort of an end-of-year performance dashboard that that my team had made that looked at whether these metrics improved year over year, which they did, which was great. And so like here's a good example. 2019, half the clients had requests that spanned service types or domains. On average, over 2 requests per person, et cetera. So that's really like kind of what that looks like down at the network level. And this also varied a lot from network to network, which is a good segue, I think, for Zach. So that's kind of the model. Like I said, if you have questions, Ben's here. I'm not here for those. No, I'm just kidding. But I'm going to turn it over to Zach.